It's interesting to look at the trajectory, sort of where Delta has run rampant before us, right? You know, sort of India and UK being the best examples. Um, and there are mixed opinions. You know, they had a very rapid rise, and then an interestingly equally rapid fall off. Two very different situations in those two countries. You know, low vaccination rate in one, and a very high vaccination rate in the other. You know, UK has a higher vaccination rate than the US does, whereas you know India had a lower. And so experts aren't of one opinion about how and why that rapid drop off happened. It may be that in India, it just infected so many people so quickly that natural immunity is ultimately what was acquired very quickly. But that came at an enormous cost. If you look at that rapid drop off, it occurred after a complete overwhelming of their healthcare system. So that is, you know, that is not the direction that we'd want to go in terms of, you know, achieving natural herd immunity by infecting an enormous number of people very quickly. UK, perhaps a better kind of correlate to us. And again, not entirely sure why it dropped off so quickly. Again, they do have higher vaccination rates, so it's possible that as the Delta variant was rising, their vaccinations kind of caught up at a certain point. But the good, I mean, both of those areas did see a pretty rapid drop off in infections after their peak. You know, the state models for New Jersey in terms of predicting our potential peak are a little more drawn out because we're kind of a middle ground. We have more vaccinations, but not enough for herd immunity, and so that may kind of draw out that infectious curve, and we may not see the steepness or the rapid drop off. And so current predictive models, though they're always wrong, right? Predictive models, you guys know this, are never right, but they can be sort of directionally accurate. And they're currently predicting a peak around October, with a fall off after that. But the models that I've seen, at least coming out of the New Jersey Hospital Association, are not predicting the same kind of rapid drop off that you may have seen in some of the other countries with Delta. And I think that's because, again, we're kind of in a middle ground between, you know, our vaccination rate as a state is okay. We're in the high 50s, but we're certainly not high enough for herd immunity. So there's still a population that can be infected and continue that kind of ongoing spread. But that said, we are definitely seeing an acceleration right now. The number of new cases each day is growing. And so we're definitely moving in the wrong direction. Whether that becomes a third wave or a smaller bump, we don't know. But I think they are predicting a continued rise, as I said, sort of up to and including October.